My name is Star Wright, and in this video today I will be going over post-operative care. The first thing that I'm going to do is, of course, go ahead and do some hand hygiene, and then I will next go by introducing myself to my patient. Hi, my name is Star. I'm going to go ahead and go over the two patient identifiers I'll be using today. Can you please present me with your full name and your date of birth?
May 30th, 1997, Monique Hollis.
Okay, Monique, today I am just going to be going over some post-operative exercises with you. We're going to go ahead and start with some breathing exercises, but if you don't mind, I'm going to go ahead and take a little listen here to your chest, front and back. Just a quick little listen. So, go ahead and inhale for me. And exhale. I'll listen over here on the side. Go ahead and inhale. Great, one more time here. Okay, I'm just going to take a quick listen here on your backside. Inhale for me. Once more. I'll go ahead and let you just do that 2 more times. Once more. Okay, and last time. Great, so far everything sounds clear. I'm going to go ahead and start with the diaphragmatic breathing. We'll go with that first. So this breathing exercise is to encourage full oxygen exchange through the lungs. You do it between 5 to 10 minutes. We're just here for demonstration purposes, so I'm going to go ahead and show you how to do that. If you don't mind putting your phone down for 5 seconds. I'm going to have you place one hand on your chest and the other right under your rib cage. So go ahead and breathe in slowly through your nose. And then go ahead and force the air out. Do you feel that movement there in your diaphragm?
Yeah.
Okay, so that was just for demonstration purposes. Now I'm just going to have you do the same breathing, just slow and concentrated. Your hand on your chest should not be moving, but you definitely should feel it there in the diaphragm. Go ahead and inhale deeply. Okay, and exhale. Okay, as you see, your stomach kind of fills up, the diaphragm area fills up like a balloon, and then you feel it release. So that is diaphragmatic breathing. Thank you so much. Next, we will be going over the ascending spirometer. You can relax for right now. So we're just gonna go ahead and get this set up. This is the spirometer machine here. Okay, I'm gonna go ahead and put this together. So this little device is just used to encourage a slow, deep breath. It actually measures the volume of air in your lungs. So this yellow indicator that we have here, that is going to determine how you can go. The goal is, you see that smiley faces, to keep that yellow ball there in the middle. Okay? So for this, we'll go ahead and just do about, we'll just set a goal of 500 there. Okay, and then what you're going to do is place your mouth on this mouthpiece. Make sure you have a good seal over it. You can suction your lips over it, and then you're going to inhale. Most people think they have to blow into it. What you're actually doing is you're going to inhale, and like I said, again, you're going to try to, we'll just try for at least 500, and you're going to try to keep that yellow ball there in the middle. I'll go ahead and place this to you. You can go ahead and hold on to it, ma'am. Okay, and go ahead and take a deep breath in. Very good. Reaching the goal. Again, go ahead and inhale. We're going to go ahead and try to keep that again one more time by the smiley face there. Good. And then you can go ahead and relax. So 80% is a very good reading. This is not contradictory with COPD. What it really is used for is to keep fluid out of your lungs and keep the lungs active. It helps to prevent pneumonia and other lung illnesses. It's mostly used after surgery, but again, it's also used to prevent or help with lung illnesses. Sorry, let me fix my setup here. So the normal lung capacity is 6 liters. And this is also used to prevent mucus and fluid buildup. So that's what the inspirometer is here. We just go ahead and clean that off. And okay, you should be using this 10 times every hour. Okay. So the next thing that we're gonna go over is the huff cough. This is also used to clear the lungs of any mucus. It kind of just clears out the airway. So what you're gonna do, oh, let me grab you a tissue, sorry, hold on 1 second. Okay, so what you're gonna do is you're gonna sit all the way straight up. Go ahead and tilt your head slightly towards the sky. And then you are going to go ahead and inhale, and then exhale sharply. Inhale once more. And exhale sharply. One more time. Inhale. And exhale sharply. There we go. So next, I want you to go ahead and put the tissue next to your mouth and give me a good cough. One more time. You can go ahead and check the tissue. There we go. Oh, yay, wow. That is an exercise used to move the mucus out of the airway, which is awesome. Okay.
Good job.
Thanks. The next thing that we're going to do, it's also used to loosen up mucus in the airway. It's called controlled cough. So I'm going to go ahead and have you sit and lean all the way forward with your feet on the floor. Okay. So you're going to go ahead and breathe in through your nose. You're going to keep your hands on your belly. Okay. Go ahead and breathe in. And then you're going to lean forward like this and exhale. Okay. Again, going to sit straight up. Hands over the belly, lean forward and exhale. Okay, we'll do that one more time. Okay, and then lastly, again, I'm going to have you have your mouth open and then go ahead and do 2 more coughs. Okay, and that is the controlled cough. So next we are going to be going over some post-operative leg exercises and just focusing on the lower extremities of the body. The very first thing that I'm going to do is go over turning in bed. It also determines my patient's mobility, and different things determines if they can move themselves, how active they are, whether it would be a 2-person assist or 1 person. But my patient today is pretty active, so I will go ahead and work with her. The main rationale of turning the patient in bed is to prevent pressure sores, to promote blood circulation, and to encourage movement in the bed. So what we're going to do first is I'm going to have you lay comfortably in supine position. Let's say if you were to have a surgery on your abdomen, I would go ahead and place your pillow here for comfort. You can go ahead and place both hands here just for comfort again. So what I'm going to have you do is okay, good area. I'm going to go ahead and have you to bend both of your knees upward and to really plant your heels, your ankles into the bed. You're going to lift up at the hips and scoot over to the left because that's the area that we have the most room to move to. Okay, just a gentle move. From there, I would go ahead and help to relax my patient, help her to reposition herself, lift up the bed. That is if she was able to assist fully. Next, I'm going to go ahead, you can scoot back over so we'll have a little bit more when you come this way. Next, we're going to go ahead and reposition. If we have the side rails available, unfortunately, I do not have a hospital bed, so we're just going to use what we have. So I would go ahead and have you straighten out one more time, and you're going to be turning to the left. So what I'm going to have you do is to keep that left leg straight. You're going to go ahead and bend the right side, the right knee upward. I would have you then take your right hand and reach over for the bed rail and shift your body that way. Bring your leg all the way over. I would assist her as needed, and also I would place a pillow behind just to keep the position and support hurt as well, especially around the ankle area and things like that. Go ahead and straighten back out. So after turning, again, turning the patient is to prevent pressure sores, to encourage blood circulation. If this was a patient that had a stroke, I would make sure to support the affected area by elevating it with some pillows and keeping the patient's head elevated. If it was a patient that was actively dying, I would turn them every 2 hours or as needed. And then again, just to reposition the patient every 2 hours is the goal. Okay, so next we're going to go ahead and go over some leg exercises. Again, I'm going to have you in a supine position for support. These exercises that we're about to do, the first two that we're about to do, are to encourage blood flow from the lower extremities back into the body. The first exercise that we are going to go over is just the bended knee. So you're going to go ahead and take your left knee. We're going to do this about 5 times and just hold that for about 2-3 seconds. Then relax. Do it on the other side. Bend the knee. Hold it. Relax. The other one. Hold that leg up. Bend your knee. Bend your knee, sorry. Hold your leg up. And relax. Then last time, just for demonstration. Okay, go ahead and relax. Okay, also, we are going to go ahead and go over extending the legs. So go ahead and lift this leg up and extend it. The left leg, sorry. Extend. You don't have to go too high. Just extend it, stretch it out. There you go. Hold it for about 2-3 seconds and relax. Again, the other leg. I don't know if you can see too well. Okay, not too high. You don't have to bring it that high. And just go ahead and relax. That again is to that is to encourage blood circulation, blood flow from the legs, lower extremities back into the body. You can go ahead and relax. From there, we are going to work on our plantar and dorsiflexion. So I like to think of it as a gas pedal. So it's gonna be about the same. You would do it. All of these exercises you do about 5 to 10 times every hour while you're awake. So what you're going to do is go ahead and take your left foot. You're gonna go ahead and press down as if you're pressing the gas pedal. You can lift it up a little bit just to give you maximum. Go ahead and press down like you're going to press on the gas pedal, and then do it the other way. There you go. And then relax. And then the other side, downward, and then up. So these feet exercises that we're doing, they're to encourage blood flow in the feet and back upwards towards the legs and circulation. From there, we are going to go ahead and the same thing how we extended your legs earlier, we're going to go ahead and extend the feet. So go ahead and stretch your foot all the way, one side at a time, sorry. Stretch, stretch, stretch. And then relax. Then again, stretch, hold for 2 seconds. And then go ahead and relax. Okay, the last foot exercise that we are going to do are some foot circulations, some foot circles. So you're going to go ahead and pick up the left foot and then rotate it in a circular motion, just as my hand is here. You can go to the left, 2, 3, 4, 5, and then the other side to the right, 1, 2, 3, 4, 5. Relax, and then the same thing to the other side, 1, 2, 3, 4, 5. The other way, 1, 2, 3, 4, 5. Go ahead and relax. Okay, so that again is to promote blood circulation in the feet and to also move the blood from the feet upward to the legs and the other parts of the body. From here, I would then again reposition my patient, make sure that she feels comfortable, provide her with the call light, ask her if she has any questions about anything, ensure that she is okay before I leave the room. And before I leave the room, I would perform hand hygiene. And that concludes my video.